even the people with the greatest willpower always want to keep popping the pimple. But I think what we have to understand is what is really a pimple.
There's a huge market for laser scar removal, and a lot of people spend a lot of money dealing with scars. How do you prevent that?
Can acne actually come back after treatment? I mean, what can we do to prevent these relapses?
What we should not be doing at home to make acne worse?
Does sweating during exercise lead to more acne?
Is that acne could be related to your pillowcase. So what is your take on that? Let's discuss. So can you sleep with your makeup on at night? And if you ever wake up with a pimple in the morning, you always wonder, what did I do wrong last night? So tell us.
You know, as a doctor, one of the most common mistakes I see in people is that they're having more and more acne breakouts because they're sleeping with their makeup. And when I ask them why you did that, the one common thing they'll tell me, oh, you know, my makeup is plant-based, it's natural, and I was told there's going to be no problem. It's like almost having my skin and I shouldn't have to remove it. But guess what? When you're sleeping with this makeup, whether it's waterproof makeup, your bronzers, blushers, those heavy foundations and concealers that you're using during the day, you're actually making the acne worse. Because what happens is your skin only gets a chance to regenerate and repair itself at night when you're sleeping. And that's the only time it can breathe. But all this makeup that you've applied that you forgot to remove at night is going to interfere with that. And guess what? Then you're going to have more and more acne breakouts. Now, once in a while is okay. But I think some people make it into a habit because they've been sold these products by certain companies telling them that it's okay. You know, it's almost as good as you're wearing no makeup at all.
Correct.
So that false impression, I think, leads to them wearing it 24 hours a day. And guess what? Worse skin health.
Worse skin. You're right. I mean, I don't think that marketing pays your medical bills.
Absolutely.
Think, right? So I think it is smart enough to just wash your face rather than risking it with a scar or with an acne problem next day in the morning. And the other interesting thing that usually comes up is that acne could be related to your pillowcase. So what is your take on that?
Isn't that fascinating?
Yeah.
I think most viewers would not even know that their pillowcase can actually be worsening
And
their
why
acne.
is that? Yeah.
And you know, there is a lot of research that has come out about it because we are now heading more and more into understanding the true cause of acne rather than just concentrating on how to get rid of it. So what happens is sometimes when you're sleeping with makeup or any different products at night, you see, you are kind of transferring these products onto your pillowcase. And now your pillowcase is a foreign object. Now you wake up in the morning and wash your face, but you're not changing your pillowcase every day.
No, I'm not.
So what is happening is there are bacteria that are growing on these pillowcases. Now when you sleep at night, you will notice that there is a lot of friction as you keep tossing and turning between your face and the pillowcase. So it's not uncommon for people to wake up with acne breakouts only on one particular side of the face. So for example, if they sleep with their left side, they're going to find more acne on their left side.
Oh, that's because it's rubbing against the pillowcase.
Exactly. So there is more friction, there is more infection, and that's why they will end up having more acne breakouts on that particular side of the face. So new research shows your pillowcase could actually be causing more acne breakouts.
Wow. And viewers, in case you have suffered from acne on one side of the face more than the other, and it kind of coincides with the side of the face that you sleep on, do let us know in the comments, because this is something new that we've heard today, and it is because of the friction. That's probably why a lot of people have acne on the face, on the cheek, on the chin, and sometimes even on the nose, because a lot of us in our younger days used to sleep with the face down on the pillow.
Absolutely.
And that's probably what's causing the issue. What I've heard from a lot of dermatology friends is that washing your face too much may not be good for your skin, or is probably the reason why your acne doesn't go away and keeps coming back. What do you think about it?
You know, that's a very interesting thing. The common misconception, I would say, or the common thing people think about is that if I have oily skin, I should wash it more because that way I can get rid of the facial oil. And you know, this has come from one personal experience. One of my closest friends who had very bad acne breakouts would actually wash her face every hour. And when I asked her, she told me that, you know, one of her beauty technicians had told her that it's a very good practice, that she should wash it more often. But you know, science kind of has looked at into this, and what we find is that if you're washing your face more than 2 times in a day, you're actually stripping your face. You're not cleaning it, you're actually stripping it away.
I see.
And you are exposing your face to more and more infections. So no more than 2 times in a day. Soap use no more than 1 time in a day, and the soap has to be very mild. It's
Gentle
not
soap.
a very gentle soap. Absolutely. I want to tell you, the more expensive and fancier soap doesn't necessarily mean it's better
good.
for your skin,
Yeah,
you know.
yeah.
So you have to make sure you're using a gentle soap. And the third most important thing is use a very soft towel.
Yeah.
And as a rule, don't rub your face dry, just dab it to dry it.
Yeah, you know
that's-
what? When we've seen people, like especially men, we like tend to like rub their
Yes.
face as if like they're trying to polish a shoe. Like, I don't know how it's going to help, but that is we are in a habit of doing that, making it more rugged. Or I don't know if that kind of comes with us. But you're right. When using a softer towel to dab your skin is much better. It doesn't irritate it, and not washing your face too much, because see, you also need a little bit of oil on the skin. It's protective. It protects your
Absolutely.
skin
Yeah,
underneath. And if you use too much of a soap, the skin becomes lusterless, it becomes dry, it becomes unattractive, and of course gets irritated. And then the cells, your oil cells, produce more oil to compensate for it.
Absolutely, yeah.
So
yeah.
which will make the acne even worse.
It's like a hamster's wheel.
Yes,
You just can't
yes.
seem to break the cycle.
Yeah, you keep doing that, keep doing that.
Yeah.
So I think what we can recommend to our viewers is not to wash your face more than 2 times a day. Is that
Absolutely,
correct?
no more than 2 times a day. And if you wear makeup,
Yeah.
perhaps you can go to a 3 times in a day. But as a rule, no more than 2 times a day, and use of soap should be only once a day. And I'll tell you, a good routine is to wash your face with soap before you sleep.
Okay.
You know, dab it dry and use a very soft, gentle cream or a cleanser on your face at night. And that is going to help your skin routine a lot, because in the night is when the skin is actually getting a chance to regenerate, to repair itself, and finally get some break. You know?
What about hot water or cold water? Doesn't matter.
You know, that's a very good point. So washing your face with hot water can actually again strip your face. So it breaks away all the protective things that are on your face. As a rule, mild lukewarm water to cold water is the best for your face.
Okay.
Does sweating during exercise lead to more acne? What are your thoughts about that?
Well, there is a little bit of misconception about sweat. Why do you sweat? You sweat to decrease your body temperature. So when you're exercising or when you're exerting yourself, your body temperature rises, and when the body will secrete the water will cool down, and your skin will feel cooler. So your body temperature will not rise. So that's the reason you sweat. Now, the sweat by itself will not cause acne if you take care of your skin. But sweat, when mixed with dirt, when mixed with dead skin, oil, tight clothing, right, or uncomfortable environment or allergens in your food like dairy and sometimes whey, that can actually lead to acne, because now that sweat is mixed with a lot of other stuff that irritates your skin. If you wash yourself, you take care of yourself, just by itself, sweat doesn't cause acne. But this is, a lot of people think that when they exercise, they sweat a lot, and they figure out that exercise is causing acne and they leave exercising. So this is one more excuse that we see in our clinics, that people are running away from exercise. But let me tell you this: if you're exercising, your insulin sensitivity is increasing, which means that your body utilizes insulin much better than it did before. So your risk of acne goes down. Similarly, your oil production goes down, your weight stays normal, so your hormones stabilize. When your hormones stabilize, there's less chances of acne. The stress goes down. When the stress goes down, there's less chances of acne. So do not leave exercising just because you think sweat is going to make it worse. It's actually helpful for acne.
Absolutely. And like you said, if you're exercising but you're making sure you're wearing comfortable clothing,
Yes.
which allows your body to breathe and ventilate well, and you obviously have a very good routine after the exercise, that you're bathing on time, I don't think that the sweat related to exercise is really going to cause any problems. And one of the things we said in our podcast earlier, and we talk about this in several of our Dr. Gooddeed podcasts, is the amount of research that has come around insulin is overwhelming and mind-blowing.
Absolutely.
And I think all our efforts today in medical science should be to make sure that the insulin sensitivity, as you had talked about, actually gets better, because that's the root cause of preventing obesity, preventing PCOD, acne, menstrual irregularities. The whole works actually, isn't it?
Insulin is, I think, the holy grail and answer to a lot of diseases, including cancer. So that is something that we need to be very careful and very cognizant about.
Absolutely.
Another misconception that we usually hear about from our colleagues and even our patients is they're using acne-safe products. They are products which have been tested in the labs and they should not cause acne, but yet they're suffering from acne. So what is the research on that? How do you explain that?
See, there is such a big market out there, as you say, where we are advertising these plant-based natural products that are so-called non-comedogenic products, and yet we have people that are breaking out into acne. And the reason is, every individual is different. Everybody's skin is different. You have different hormone levels. The oil levels on your skin are very different. At the same time, our bacterial balance on the skin is very different. You will realize that people who have gut issues, those who have a lot of bloating and diarrhea, tend to have way more acne than those people who don't suffer from gut issues, okay? Right. So your skin bacteria are also very different. Every individual has a different way of reacting to a certain product. So when we are using these so-called non-comedogenic products, we are actually still going to break out into acne because we are all very different.
And sometimes I think it is very important for us to realize that just because something is so-called plant-based, or something is based on an ancient system of medicine, or is based on an ancient system of medicine on alternative medicine, doesn't automatically make it safer. I mean, we have to kind of have a more rational mind in evaluating such products and not just fall for all the marketing gimmicks.
Absolutely, you're absolutely right. And what we have to also realize is that sometimes we want to go with a little bit of a trial and an error, not have blind faith.
Yeah.
It's always a great thing to look back at to what the science is saying about a certain thing. And like you said, just because something is more natural, more traditional, that doesn't mean that it's going to be the same. We no longer have the same traditional eating habits as we used to. Our stress levels are very different from what they used to be 500 years ago.
True.
So why should that particular therapy that worked then work for us today?
So while we're discussing safe dermatological products, what are certain components of these products that actually irritate the skin, even if it's not like a chemical-based product or a plant-based product?
So, certain things in these preparations can be very irritating to the skin, as research has already shown. The number one is fragrance. The more nicer smelling the product is, the more chances that it's actually going to cause irritation to your skin. The second is the alcohol content. So you need to start reading the label on your products, and you're going to realize so many of your soaps, creams, facial products have got alcohol in them. The third is preservatives. The more preservatives, the more skin irritation. The fourth is oil. So if there is a greater amount of oil in the product, we're going to get more acne breakouts. Isn't it very attractive when we go to the mall? I think we're all attracted to that one shop that has the best fragrance, right?
That's the acne shop of the mall.
Exactly. So while we are also talking about makeup, I also wanted to think about what about salicylic acid and benzoyl peroxide, two very important chemicals that are usually advised and used by people for acne. What is their mechanism? How do they help?
So both of them can be used topically, and both of them are used for acne. When it comes to salicylic acid, it helps to declog the pores. So it basically helps to kind of detox the skin from outside and reduce the risk of acne. So if you have mild acne, you got blackheads and whiteheads, salicylic acid is a very good thing to use, and it's very safe. Benzoyl peroxide is a little stronger, I would say, usually reserved for moderate acne when you have large angry pimples. And benzoyl peroxide actually works against the bacteria, which is called Propionibacterium acnes, to kill the bacteria and reduce the acne incidence. Having said that, both of them need to be used under supervision. Don't just start using it because you can get it over the counter. It is always supposed to be followed under proper guidelines, how many times a day, depending on how old you are, how much of an acne do you have, where do you have the acne. All these things do matter while making that decision.
Absolutely. I think it's a very good thing to understand that when you do break out with acne, meeting with a doctor first offhand is a very good technique.
It's a smart thing to do.
Absolutely.
I don't know why do we even have to stress this out, because it's about your health, your face, your body. If you're not going to take care of it, then you are going to pay the price later.
Absolutely. And just remember that we're talking here of most people trusting wellness centers and trusting Google and several times many beauty salons to give them a lot of advice on acne treatment, when that is really not the right way to go.
And then you end up spending much more money to correct what has gone wrong. So how can you prevent scars from acne? I think that is the most important question, and a lot of people spend a lot of money dealing with scars. How do you prevent that?
I think there are certain things you have to follow, certain tips. Number one, get treatment for acne as early as possible. That's very important. Number two, stop popping your pimples. Number three is wear sunscreen at all times. Anything with an SPF or a sun protection factor above 30, even when you're inside the house.
Indoors and outdoors.
Absolutely, indoors and outdoors. Number four is fix your lifestyle. Make sure you're dealing with stress in a more effective way. You are sleeping on time. You're trying to improve the gut balance in your colon by eating foods that are very rich in probiotics like yogurt and kimchi. Because remember, preventing scars from acne is far easier than fixing them.
I agree. And I think there's a huge market for laser scar removal and peels, chemical peels, natural peels that people use for scarring. So what if somebody has a lot of acne scars? What is your take on laser and chemical peels?
Actually lasers and chemical peels, they do tend to work. They absolutely do. But they will only work if you're getting it done under the care of a clinical dermatologist.
Sure.
Because you have to understand, we have a lot of these cosmetic clinics right now that are giving you laser, but they're being done by professionals who really have no idea what kind of laser, what amount is good for your face.
Correct.
Remember, this is your face you're dealing with. You have to be very careful. So lasers do work, provided it is under the supervision of a well-trained doctor.
Fair.
So I think, can acne actually come back after treatment? I mean, what can we do to prevent these relapses?
See, in a way, acne is like an infection. So the infection can come back again. There can be more bad bacteria on your skin and acne can keep coming back. And it usually happens in people who are actually, let's say you've had acne, you got better, and you did not complete the treatment and you left it in the middle. So that's one thing. So intermittent treatment or not completing the course. Second thing is, even after you completed the course, sometimes you need maintenance therapy for some time so that acne doesn't come back. Your body needs time to stabilize. Number three, people who have hormonal problems like polycystic ovarian disease, hypothyroidism, or oral contraceptive pills. So they can have acne come back again and again with these issues if they are not fixed at the root cause. Then there's a big number of people who suffer from food intolerances, like they are allergic to dairy, right? Some people are allergic to proteins in dairy, like whey. Now, if you keep consuming them and if you keep exposing your body to these antigens, you will probably end up having acne again and again. So I think I would recommend, like for a lot of teenage people who come to us and who talk about these things, we tend to recommend them to actually change their protein source. See, protein is very important.
Absolutely.
And whey is a great source of protein. So but it doesn't suit you, then you choose a plant-based protein or choose another kind of protein that kind of suits your body so that you don't have acne and again. But you have to figure out what is the trigger. You will be amazed to know there's certain people who have acne because of the kind of deodorants they're using. Because those deodorants have more preservatives and irritate the skin a lot more. And then there are certain individuals who have acne because of the kind of clothes they're wearing. Either they're wearing non-cotton, tight clothes in summer, so there's not a lot of circulation, the sweat and the dirt always stay on the skin, and that causes a lot of infection and acne problems. So you have to get to the root of the issue before you say acne is going to come back or not. But most of the cases, if you do take care of yourself, acne goes away.
So what I understand is basically preventing a relapse of acne is a game of patience.
Correct.
You have to be very, very patient. It's not an easy fix. It's not something you did once and it will never come back.
Yeah.
So, I want to ask our viewers, please write to us in the comment section if you're one of those people who's been dealing with recurrent relapses of acne, and let us know if the information we gave you today has helped you at all.
So before we discuss what is a very effective skincare routine for acne, why don't you tell us what we should not be doing at home to make acne worse?
So number 1 is please don't pop your pimples. Number 2, do not use lemon or vinegar on your face thinking it's acidic and therefore will get rid of the pimples. Number 3 is please don't use toothpaste on the pimples.
Oh.
That's a very common thing people tend to do, apply it overnight. And number 4 is please don't use a lot of hot steam or any face masks like that can worsen your pimples. Number 5, please don't use toothbrushes or very rough exfoliants. All of these skincare routines can be very bad. And another thing is, please don't rely on all these miracle, over-the-counter, overnight acne removal treatments.
Correct. None of them work.
Absolutely not, because many a times these can actually make your acne worse.
So while we are at it, why don't you tell us what can we do at home or effective home remedies for acne?
So certain things that are there in everybody's kitchen can be used. Number 1 is using raw honey, aloe vera gel. Number 3 is using oatmeal face masks that really calm down your face. Number 4 is using ice for inflammation to calm it down a little bit. And number 5, even if you haven't done any of the others, is making sure you're drinking 6 to 8 glasses of water every day as a ritual.
Yeah, I think that's the easiest and the most ignored advice ever that a dermatologist will give you is use a lot of water. Hydration protects you against acne and almost every disease known to mankind. And for all our viewers, if you're not drinking 8 glasses of water, just write it in our comment section. So we find it difficult to meet our daily hydration goals. If you're facing the same difficulty, do let us know. We'll probably discuss this in another video. But I think this brings us to the end of the podcast.
Absolutely.
Thank you for being a part of this podcast. If there's any topic or any medical issue that you need to be discussed, please do mention it in the comment section. If you have any suggestions for us, do mention them as well.
Our job at Dr. Good Deed is to make sure that we get you the right information. Until the next video, goodbye.